Now in our Vidant Health Spotlight this morning, Dr. Clinton Faulk has joined us, and we're going to talk about strokes and stroke prevention. How are you this morning?
Good morning, sir.
Good to see you.
Good to see you, too.
Now, are you what is your specialty?
So I'm a physician for ECU physicians, but I work at the Vidant Medical Center for inpatient rehab. So my specialty is rehabilitation medicine. So primarily it focuses on stroke rehabilitation, but also we take care of patients in our rehab center with amputations, brain injuries, spinal cord injuries, all different type of disorder, pretty much anything that comes in, but we do focus heavily on stroke and neuromuscular and neurological diseases.
You know, you hear the term stroke and everybody just kind of freaks out because there are different levels of stroke, and you think about a loved one that you've known, maybe an elderly person that's had a stroke, or but you know, it's interesting. Younger people have strokes. And there are different levels of stroke. I mean, it's not unusual for young people to have strokes. I mean, let's talk about preventing stroke. What can we do?
Sure. So there's some factors that we can prevent and some that we cannot. Some things that we can't prevent is age. So as we all get older, particularly over 55 years of age, our risk factor goes up for having it. Gender, if we're male, it's a higher risk factor. Family history, if you had a family member that's had a stroke, that also increases your risk for a stroke. So some things are kind of out of your control, but many of the things that we can control, we can, which is high blood pressure, which is the main reason that strokes occur. So controlling high blood pressure, if you have diabetes, that's also a risk factor. We also recommend not smoking because that's also another big one. High cholesterol, your diet, high diet that's in fats and cholesterol is not good. So there's a lot of things that you can prevent, and that requires you to go to your physician, routinely, take your medications routinely. But it really is a preventable disease, and so it's something that we're trying to improve on. It's still one of the leading causes of death in North Carolina and the United States. The numbers are starting to slightly improve, and I think that's partly because from the data that's been collected is that the prevention measures taken, education of the public to see what the risk factors are. Because it really makes a difference. Knowing what the risk factors are and then getting to treatment as soon as possible has made a big difference.
When someone's having a stroke, what's actually happening? What is a stroke?
So it's pretty much you get a blockage of a blood vessel that in your neck into your brain. And so that blockage will keep the blood flow from getting to the proper area, so it causes cells in the brain to die. And so mostly it's called an ischemic stroke. That's the higher percentage of blood clot sits there. A smaller percentage is called a hemorrhagic or a bleeding stroke, where somebody has an aneurysm and it ruptures and it causes blood to occur and causes the symptoms to happen. So those are the big ones that you need to recognize, but also people know a term called TIA, which is a transient ischemic attack. So those also should be taken very seriously.
Those are more prevalent, right?
Yes,
a lot
sir.
of people get TIAs.
They do, and some people, these symptoms only last for 1 to 5 minutes, and the symptoms you're looking for, and we call it FAST, F-A-S-T. So we're trying to recognize facial drooping when it happens right away, arm weakness, which is the A, and then speech difficulties is the S, and then T is to call 911 and get treated right away. So those symptoms can occur with the TIA also. The difference is that TIA symptoms last 1 to 5 minutes typically, and you get better. You still need to be seen and evaluated because that's a precursor for getting a stroke. If the symptoms last longer, it's more likely a stroke that's occurring. So it really recognizes the symptoms right away, and it's important because the time frame that you recognize it and get treated can affect what treatment you get, and the treatment that's out there can be very beneficial to correcting the stroke and making your deficits less likely.
Dr. Clinton Faulk from ECU Physicians in our Vidant Health Spotlight this morning. We're talking about stroke and preventing stroke and all information about stroke. And this is Stroke Prevention Month. We hear a lot that we live in the stroke belt. Are we still considered the stroke belt? I mean, Eastern North Carolina, we like barbecue. People still eat some fried foods here. I mean, is that why we're still the stroke belt?
We still are, and some people like to say the buckle of the belt too. So we're really in the center.
Does that mean we're the worst in the country? That's not funny, I guess, but I mean that's probably true, isn't it?
Yeah, and it really has to do with just trying to improve recognizing the symptoms and the education of what to do when it happens, and having the opportunity to provide a care for the patient here. So in Eastern Carolina, the medical school and university focus really is on rural education of patients and families to recognize and get the treatment faster. So we still are in the stroke belt and kind of in the middle. Again, the numbers overall are probably improving due to education, but they're still really high. For North Carolina, the fourth leading cause of death still. and it's one of the leading causes, if not the leading cause of disability in the state and the country too.
Are blood pressure medicines better these days?
They are better. There's always newer ones coming out. There's ones that have been there forever. There's combination medications that different blood pressure medications combined to make things better. So there's always newer and better medications coming out. And so that has been a big difference. And so it's really important just to make sure you take them. Don't skip a day of your medications. I see patients that will come in and say, well, I just ran out of my medications for a day or two or a week, and then this happened to me. So it's not 100% that if you take this medication, it's going to prevent it. But that's one of the risk factors you can control, and the biggest one that you can control.
Right. All right. Did I see that you guys have an event or something coming up? Was that the other folks that were?
I think it's the other folks. It's really pretty much a month-long event that we're
Right.
doing for awareness. Really getting people just to recognize what this is and what can happen with this. So, a thing we like to stress too is not just to recognize and get treated, but what happens? Does it mean if I have a stroke that I'm going to die, or I'm never going to recover? Am I going to walk again? And so it really is, after you've had the stroke, the first 3 to 6 months afterwards is the key time to really get the treatment and get to rehab. So I work in the rehab center here, and so most recovery occurs in that first 3 months. Mm-hmm. And so it's really important to have 24-hour physician care in the rehab hospital with our nurses and therapists that work with you 3 hours a day to really work on not just speaking again, but all the things about moving again. And there's a different spectrum. Some people recover fully from a stroke. Some people don't recover hardly any function, and some people come somewhere in between. And so we would like to work on things called, not just walking and those things, but activities of daily living, bathing, dressing, getting to and from the kitchen. Those things that we take for granted are important functions that we try to get our patients to recover, because we want them to be back in the community, want them to be back at home. And so it's not just recognizing and treating the stroke, but also treating the aftermath of the stroke and get their function to improve. And so that's really a key for us.
Well, again, we say this all the time. We're so fortunate to have a medical center here like Vidant Health and Vidant Medical Center with a rehab center. I've had some experience through loved ones in the rehab center. You folks do an incredible job, and we are very fortunate to have you here in our community. So thanks for all that you do.
Sure, you're welcome. We're glad to do it. And the community is also welcome. We have at the second Monday of every month, we have a stroke rehab support group that meets in the rehab center at 6:30, and that's really good because that's the chance for you to see if you've had a stroke or you've had a member of your family that's had a stroke. Our patients come to that, so it's patients who have had a stroke, those who have recovered from a stroke, or a loved one. So it's really important. You can kind of see where people will be later on. It kind of puts it into perspective, and so it's a really good social network for families and friends and people who have gone through this process together.
All right, Dr. Clinton Faulk from ECU Physicians and Vidant Health Rehab this morning. Great to have you here. We appreciate all that you do, and it's been great talking to you today.